the incontinence issue was always a bothersome thing. So on a scale from 0 to 5, 5 being totally incontinent and 0 being perfect, I was in around a 3. And, you know, I wore things to protect my clothing, and I thought that, you know, that was the way it was going to be. They said you would reach a point and that would be it. So it was something that I just became comfortable with, and uncomfortably comfortable with, I guess is the best explanation for it. And so we went on for a couple of years until my urologist recommended a male sling. And he explained what it would be. It would be implanted in my body, and it would actually give me the support that would help the light incontinence that I had. So we tried that a couple of years, actually, 2008, 2009, we tried that. And of course, of the 3 or 4 he did that day, mine didn't work. And the reason mine didn't work is because the tissue had been changed, the consistency of the tissue in my body had been changed by the radiation. So instead of regular soft mushy tissue, it changed leathery-like inside, similar to some of those cell phone cases that you see on the road. So it just didn't work. So, you know, again, it's an emotional roller coaster. You're up, you're down, you're up, and you're down. And then again, I just became complacent. I said, well, it is what it is, and that's what it's going to be. But my urologist, who actually specializes in reconstructive procedures, and also is not a quitter, contacted me about 7, 8 months ago and said, guess what? There's a new procedure, and it's a new device. It's called an Argus sling, and it's actually one that's designed for people that have gone through the radiation. So in Easter, just in March of this year, I went in for that procedure, and I'm happy to say it worked. And so that's changed my life again, certainly to the positive. And I think that's very important for people to know, that there are lots of things out there now, and there are lots of things out there being developed that are going to help people deal with some of the ongoing issues that may or may not affect prostate cancer patients.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.